Imagine this: you're out for a walk, perhaps just going about your day, when suddenly, you feel a sharp pain in your hip. At first, you think it's just a muscle strain or maybe a small bruise from bumping into something. But what if that pain is something more serious, like a pelvic fracture? A broken pelvis isn't something we usually think about, but it can happen to anyone, anywhere, and when it does, it can turn your world upside down. Pelvic fractures are more common than you might realize, and the consequences can be life-altering. They're not just a problem for athletes or the elderly, anyone can be at risk. Whether it's from a car accident, a fall, or even just the wear and tear of daily life, understanding what a pelvic fracture is, how it happens, and what it means for your body is crucial. But don't worry, by the end of this video, you'll be equipped with all the knowledge you need to face this challenge head-on. What is the pelvis, and why is it so important? First, let's talk about the star of the show, the pelvis. Your pelvis is like the foundation of a building. It holds everything up and keeps everything stable. It's located right below your abdomen, nestled between your hip bones, and it's made up of several key parts: the sacrum, coccyx, ilium, ischium, and pubis. Think of the pelvis as a ring, or better yet, a bowl. This bowl-shaped structure isn't just there for support, it also plays a huge role in movement. Every time you walk, sit, or even just shift your weight from one foot to the other, your pelvis is hard at work. It's where many of your muscles, tendons, and ligaments attach, making it essential for almost every move you make. The unexpected reality of pelvic fractures. Now, what happens when that sturdy, dependable pelvis gets injured? A pelvic fracture is like a crack in the foundation of a house. It can compromise the stability of your entire body, leading to pain, limited movement, and a long road to recovery. Pelvic fractures aren't just a single event, they can vary widely depending on which bones are affected, how severe the break is, and what caused it. You might think that a fracture only happens in extreme situations, like a car crash or a big fall, but that's not always the case. Sometimes, just the gradual wear and tear from daily life or a slight misstep can lead to a break, especially if your bones are already weakened. The different phases of pelvic fractures. Let's break down the types of pelvic fractures, because not all fractures are created equal. 1. Ilium fractures, the hidden pain. The ilium is the broad, flat bone that forms the upper part of your pelvis. An ilium fracture can happen anywhere along this bone and can range from a tiny crack to a major break. If you fractured your ilium, you might notice sharp pain in your hip or groin, swelling, and bruising. This type of fracture can be tricky because the symptoms might not seem severe at first, but ignoring it can lead to bigger problems down the line. 2. Ischium fractures, the weight bearer. Next up is the ischium, the bone you're sitting on right now. It's the lower part of your pelvis, and it forms a ring with the pubic bone. This ring is crucial because it allows nerves and blood vessels to pass through to your legs. A fracture here often happens after a fall or an accident, and it can make it almost impossible to put weight on your hip. The pain can range from a dull ache to something more intense, and it's usually accompanied by swelling and bruising. 3. Pubis fractures, the silent sufferer. The pubis is another important part of your pelvis, forming the front part of the pelvic ring. Fractures here are most common in older adults, often as a result of a fall or even just from repeated stress on the bones. Pubis fractures can be incredibly painful and make it difficult to move, sit, or walk. Even simple activities can become a challenge, and the pain can linger for weeks or even months. 4. Acetabulum fractures, the socket stopper. Then there's the acetabulum, the socket where your hip bone fits into the pelvis. Fractures here are less common, but when they do happen, they're usually the result of a high-impact injury, like falling from a height or being in a car accident. These fractures are serious because they can damage not just the bone but also the surrounding muscles and tissues. Recovery can be long and painful, often requiring surgery and extensive rehabilitation. 5. Stress fractures, the quiet culprit. Finally, let's talk about stress fractures. These are tiny cracks in the bone that develop over time due to repetitive forces, like running long distances or jumping repeatedly. Stress fractures can sneak up on you because they don't happen all at once. They're the result of cumulative damage. If you have osteoporosis or weakened bones, even the normal wear and tear of daily life can cause these fractures. Stable versus unstable fractures, the difference matters. When it comes to pelvic fractures, there's another important distinction to make: stable versus unstable fractures. A stable fracture is like a crack in a windshield. Yes, it's broken, but everything is still in place. The bones haven't shifted, and while it's painful, it's usually not life-threatening. Stable fractures often happen from lower energy impacts, like a minor fall or a small accident. On the other hand, an unstable fracture is more like a shattered windshield. The bones have moved out of alignment, and the structure of the pelvis is compromised. These fractures are usually the result of high-energy trauma, like a car crash or a significant fall. Unstable fractures are much more serious and often require surgery to realign the bones and stabilize the pelvis. Causes of pelvic fractures: more than just accidents. You might be wondering, how do these fractures happen? Well, it's not always as dramatic as a car crash or a fall from a ladder. There are actually several ways you can end up with a fractured pelvis. Bone inefficiency, the quiet saboteur. One of the most common causes, especially in older adults, is bone inefficiency. As we age, our bones naturally become weaker, and conditions like osteoporosis can make them even more fragile. In these cases, a pelvic fracture can happen during routine activities: walking up the stairs, getting out of the bathtub, or even just standing up. These fractures often don't cause damage to the nerves or blood vessels, but they can still be incredibly painful and debilitating. High-energy trauma, the sudden shock. Then there's high-energy trauma, the kind of force that comes from a head-on car collision, a motorcycle crash, or falling from a significant height. These injuries are often life-threatening and require immediate medical attention. High-energy trauma can cause severe fractures that damage not just the bones but also the surrounding tissues, nerves, and blood vessels. Other causes, the unusual suspects. Finally, there are other, less common causes of pelvic fractures. For example, an avulsion fracture happens when a piece of bone detaches where a tendon or ligament attaches to the bone. This can occur during sports or other physical activities that involve sudden, forceful movements. While less common, these fractures can still be painful and require treatment. Treatment options: finding the right path to recovery. So, what happens if you or someone you know ends up with a pelvic fracture? The treatment plan will depend on several factors, including the type of fracture, the severity of the injury, and the overall health of the patient. Non-surgical treatment, the slow and steady approach. For stable fractures that are minimally displaced, non-surgical treatment is often the best option. This might include using walking aids, like crutches or a walker, to take the weight off the injured pelvis. Pain management is also key, with medications to help control discomfort while the bone heals. Physical therapy may be recommended to help regain strength and mobility as the fracture heals. Surgical treatment, the more aggressive option. In cases where the fracture is unstable or the bones are significantly displaced, surgery may be necessary. This could involve internal fixation, where screws, plates, or rods are used to hold the bones in place while they heal. In some cases, skeletal traction might be used to align the bones before surgery. Surgery is a more aggressive approach, but it's often necessary to ensure the bones heal properly and to prevent long-term complications. Recovery, the road back to normal. Recovering from a pelvic fracture is a journey, and it can take time, sometimes up to 12 weeks or more, depending on the severity of the fracture and the treatment plan. During this time, it's important to follow your doctor's recommendations, including using any prescribed walking aids, attending physical therapy, and managing your pain. The good news is that with proper care, most people can fully recover from a pelvic fracture and return to their normal activities. But it's important to be patient and give your body the time it needs to heal. Conclusion: facing the challenge head-on. Pelvic fractures can be a serious and life-altering injury, but they're not something you have to face alone. Whether it's understanding the different types of fractures, knowing the causes, or exploring treatment options, being informed is the first step in taking control of your health. Remember, your pelvis is the foundation of your body. It deserves your attention and care. So, if you ever find yourself dealing with a pelvic fracture, or if you just want to be prepared for the unexpected, you now have the knowledge to face the